Gentlemen, we are Healthcare Heroes from 6 East, and we want to present to you our board, and it is on fall prevention. At this time, I want to hand it over to my lovely assistant and co-worker and Healthcare Hero from 6 East, Miss Ebony.
Ebony, along with Miss Tom too,
That's
okay?
right.
She got all the information together for the board. So a little bit about the background. Every year, 700,000 to 1 million people fall in a hospital. Hospital fall rates vary between 3.5 to 11.5 falls, 1,000 per day. Almost 25% of falls causes injury to patients, increasing patients' hospital stay, and also healthcare costs and liability. The current state of falls in the healthcare system.
So here's our current situation today. In the last 6 months, we've collected data, and we were able to determine that 56% of falls were related to toileting issues, all right? Now, in addition to that, 23% of the falls were getting out of the bed or getting out of the chairs, okay? We're gonna discuss that, what we implemented a little bit later, but the percentage of males versus females, 60% males, the falls were attributed to them. You know, sometimes men, we want to see that we're independent, we want to do things on our own, we don't want to call a nurse. And 40% of the falls were by females. The age group was 45 to 75 years old. That made up 65% of the falls, 45 to 65 years old. Most of the falls were identified not on the day shift, really, or not on the night shift. It was a little bit equal with both. Only 51% of those falls were identified by the evening shift. Now, we're gonna turn it over back to Ms. Ebony to talk about the data we collected also as well.
So Ms. Tom collected data over a year's time span from January 22 to March 23rd, and she found that falls had increased. There were a lot of falls, and let's see here, between January 22nd until March of
This year.
23. So averaging about 14 falls per day in the hospital. She also found that the injury rate. Most patients receive injury, but not life-threatening injuries. Basically, maybe about 8 patients receive injuries throughout their whole year time span, but not life-threatening injuries.
Okay.
She implemented interventions to help with decreasing the amount of falls that patient received in a hospital setting.
And most of you all know about the rapper. We had a great time making the rapper videos a couple of years ago, and so we went back to our roots and our foundation, and implementing purposeful rounding, assessing the patient, getting together between shifts, talking to the charge nurse, the incoming staff about what we needed to do to plan for prevention. And then education was definitely a key, and those things that we found out that worked, we repeated it, and so that was the wrapper, but also we implemented the 6 Ps.
Yeah, so nurses do rounds every hour. If the nurses are unable to do rounds every hour, the aides also do rounds to check on the patient, assess the patient for pain, check them to see if they need to have any bathroom breaks, go to the bathroom, check the pump. The nurse checks the pump to see if everything is running according, see if everything is still connected, not twisted or tangled around the patient. Position the patient, make sure their personal items are near them, ask them if there's anything else they need before they leave the room, and also make sure they have privacy when they leave the room.
All right. And so that leads us to some of the things that we utilize or should utilize every day. Every fall risk patient needs a fall wristband. And then you have the, what's it called?
Palsy sitter.
Right. Go ahead, you want to explain that a little bit?
Okay, so when the patient is sitting in the chair, they put the palsy chair alarm on the patient to make sure that if the patient gets up out of the chair, unbeknownst to the nurse, when she is not there or any staff member, alarm was set, and it also set off the call alarm system, and the staff can know, let's go to this room and see what's going on with the patient.
And in addition to that, we also, as you know, have a bed alarm. And so this is the Heel Run bed alarm, and that alerts us when any patient that is a fall risk attempts to get out of the bed.
Okay, after she implemented, well, before pre-intervention, just for 2 months, let me make sure I got these 2 months correct. For the month of December 22nd and January 23rd. So just those 2 months spent, she found that, the hospital had 14 falls during that time. Related to injury was 12. And falls in med-surg in December, so in December, there were only 6 falls in the hospital.
So at some point it escalated between January and February, which led us to go into action. And because of the action our coordinator, Ms. Mimi Tom, put into place, this was the post and the results, right? So the post intervention was that we were able to decrease the amount of falls to 67% decrease falls, right? And 40% injury decreased, right? And this is what led us to our month of March that we are so proud to talk about. On the 6 East unit, we had no falls in the month of March on 6 East. And this is our presentation for our fall.